So demographically speaking, brain injuries are really interesting. Most of the people that suffer significant brain injuries are children ages 5 to 9 or adults over the age of 80, and that has to do with just the structure of the brain, the fact that children are growing their brains and they're creating new nerve pathways. So that's why kids are more susceptible than middle-aged adults. And then finally get over the age of 80, things start to break down, there's less matter in the brain to protect it, so they're more susceptible to more significant injury as well. And interestingly, men are more likely to be brain injured than women, primarily because they're more active or tend to be more active, particularly in sports. However, of those people that are injured, that suffer brain injury, women are more likely to be greater impacted than men. So if you have a man and a woman who suffer significant or similar injury to the brain, the woman, unfortunately, is more likely to have long-standing, long-term effects than the male would. In addition, there's some studies out there that indicate that up to 85% of traumatically injured children have some form of brain injury. That's a shocking statistic. If you think about 85% of kids involved in an auto accident, a significant auto accident, not a fender bender, have some sort of traumatic brain injury. And unfortunately, a fair amount of those, 66% of moderate brain injuries, 100% of major brain injuries, and up to 10% of what are called mild brain injuries are going to be permanent in nature. So of all the kids that are injured, there is a significant portion that, one, suffer brain injury, and then two, have a permanent brain injury to boot. There's many common causes of brain injury. Most often, well, let's look at this diagram. This diagram shows statistically the most common causes of brain injury that result in death. And you'll see that 39% are due to firearms, 34% are motor vehicle accidents, 10% are falls, and then 17% are what's called other. That includes drowning, suffocation, things of that nature. What we see most often here in the firm are injuries associated with motor vehicle accidents, particularly significant frontal impact where the car stops and the body continues forward, but then perhaps a seat belt or an airbag stops the head from moving forward, and so the brain pushes into the front of the skull as the head stopped, and then it rebounds back into the back of the skull. So you have both a frontal and a rear brain injury from that. We see also common brain injuries from falls, particularly down higher heights, a full stairway, or off the top of a ladder or roof of a house, things of that nature. We see brain injuries from sports, although we don't handle many sports cases, to be honest with you. But we do hear of brain injuries from particularly football, basketball. If you think about it, you're playing basketball on a hardwood floor. People undercut you. You're going up to rebound the ball or dunk the ball. You get undercut, you land on your head. It's happened to me. I've been fortunate enough not to suffer a brain injury, but it can easily happen. A lot of snowboarding or skiing accidents that have resulted in brain injuries. So sports, of course, are a major cause and source of brain injury. And then those involving children, most often what we see are injuries involving kids, not just from the autos, and the auto accidents are separate. We've seen a few of those. But separating out the automobile accidents, you see brain injuries most often involving kids that are abused, and then secondarily kids that are injured in sports, as I just discussed, and then finally kids that fall off playground equipment. It happens, unfortunately, all the time, or are assaulted at school. So you see we've seen a handful of school cases where a child has either fallen off the playground equipment without adequate fall protection, or had been assaulted at school by classmates. It's a sad situation to see, but it does happen.